Mr. President, this is the first time in 11 years that a chairman of the Labor, Health and Human Services and Education Subcommittee has had a chance to stand on the floor and present a bill. This is a subcommittee that I'm honored to get to chair. It's a subcommittee, Mr. President, I'm honored to get to be on with you. It's a subcommittee that is led on the other side by Senator Murray from Washington, the ranking member on this committee. This is not a bill that either Senator Murray and I would have drafted on our own, but our job was not to draft a bill that was a bill that I thought was the perfect bill for me to vote for, the perfect way for all of these agencies to be run. There is a reason that this bill hasn't been on the floor in 11 years. It's big, it's complex, it can be contentious, but Senator Shelby, the chairman of the committee, Senator Leahy, the lead Democrat on the committee, have made an incredible good faith effort to try to come to the floor with a bill that talks about how we spend the money. There's not much new in here about all of the things that we could try to determine in this bill about social policy and about issues that all of us feel strongly about, but there are other committees whose principal job is to do that. Our committee's principal job is to decide how we establish the priorities for the country by how we spend the money. Senator McConnell and Senator Schumer have also both had to agree that if we're going to get these appropriations bills on the floor, if we're going to have all the members of the Senate for the first time in the case of this bill get a chance to debate this bill for the first time in 11 years, that's not going to happen if we try to have a big authorizing bill and a big appropriating bill all wrapped into one. I see the ranking member has come to the floor right after I praised he and Senator Shelby for the unique leadership they have had that has allowed us to get this bill on the floor. This bill deals with everything from medical research to home energy assistance to employment opportunities and training programs and Pell Grants for people who are trying to go to college that don't have the resources that would allow them to do that otherwise. It is the largest of the non-defense discretionary bills. About 30% of all the non-defense spending is in this one bill. So you take that bill and add it to the defense spending bill, and suddenly you're looking at roughly 62% of all the spending of the federal government, which still sounds like a pretty big bill, but it's the first time in the case of the labor, health, human services, education, and then we've got that unique add-on and related agencies, just to get the footprint even a little bigger. It's the first time in over a decade that members have been able to come to the floor and say, no, we'd like you to spend the money here rather than here. And by the way, Mr. President, as you understand, to do that, that member also has saying, here's where we're going to take the money from to pay for it. So it's not just on the floor and you get to make up all the spending you want to that those of us on the Appropriations Committee didn't have a chance to do. There is still a finite amount of money. And so in the amendment, like your amendment, Senator Kennedy, that will be offered right after we finish this morning's discussion and go to votes, you had to come up with an amount of money to pay for that. And I'm fully supportive of the amendment that you and Senator Reid came up with to deal with the pressing issue of suicide prevention and the disturbing suicide rates. And in my state, in Missouri, suicide rates have increased by 36% above where they were in the year 2000. 36% increase. Too many of those are our veterans. Too many of those are people who serve on the front lines of Homeland Security and police and veterans. All of that is something that we need to look at. And here's your opportunity, which you took opportunity of, to say, no, I think there's a better way to spend some of this money than the committee spends it. And that's what we've missed for the last 11 years when 69 of the senators didn't have any say as to what the 31 of us that serve on the Appropriation Committee need to debate and talk about. So we bring this to the floor. There were 6,164 ideas that came to Senator Murray and I, 6,164 member requests ideas as to how this could be the best possible bill. I think most of those are reflected in what we do. In this bill, we talk about fighting the opioid epidemic. We talk about promoting college affordability, strengthening the workforce, and having them better prepared for the jobs that are out there to be filled than they would otherwise see. Now, both sides would approach drafting this bill differently. We'd both start out with some significantly different set of priorities, but we've been able to reach an agreement that neither of us would have drafted on our own, but not the job that wasn't, again, the job we were given. Been able to present a bipartisan bill to the full committee and have that bill referred out of the full committee, 30 yes and 1 no, bringing that bill to the Senate floor. Represents a compromise on both sides. It represents stepping back a step on issues that authorizers can deal with at a later time on both sides. And certainly I appreciate not just Senator Leahy and Senator Shelby's leadership here, but also Senator Murray's in helping determine what those priorities would be and should be. See Senator Leahy is standing on the floor, and I'd be glad to yield to him for a comment. And again, this is the first time in over a decade where the 69 people who aren't on the Appropriations Committee get to come to the floor and offer amendments and think about what this bill does. So let's talk about some of the things it does. We worked really hard, particularly over the last 4 years, to do the kinds of things we ought to do in healthcare research. This bill, for the first time, reaches a long-held goal of the National Plan to address Alzheimer's disease, of getting that annual research dollars up over $2 billion. In fact, it's $2.34 billion, exceeding what had been the long-term goal. But the goal here should not be how much money we spend. It should be finding a way to solve this problem. This is a significant increase over where we were last year, but it quadruples where we were 4 years ago. We're spending $277 billion tax dollars a year on Alzheimer's and dementia-related care. A lot more private money is spent than that, maybe 3 times that amount in private money and lost work as caregivers step back to help people with these terrible diseases of dementia and Alzheimer's. But $277 billion. So this bill does about 1% of that in research to try to solve a problem that taxpayers are overwhelmed by. It is a problem that by 2050, if we don't find a solution, we'll be spending about twice today's defense budget, Mr. President, on Alzheimer's care. Twice today's defense budget, 1.1 trillion of today's dollars being spent on Alzheimer's care if we don't do what we need to. This is the only leading cause of death that doesn't have a treatment, doesn't have a cure, doesn't have a way to prevent it, and obviously the right kind of discovery, the right kind of medical advancement can change the lives of millions of American families now and in the future if we do that. So I'm pleased to see we're making that investment. I'm also pleased to see that after a 12-year period when there wasn't any increase in healthcare research spending at all, that we continue to find money, in many cases by eliminating programs that weren't working, to where we will have had a 30% increase in NIH funding over the last 4 years. And what 4 years to be doing that, understanding the things we know now about the human genome, understanding how each of us is different than all of the rest of us, and that in fact each of us have a different capacity to fight disease than any other person does if you can figure out how to maximize that. Things like immunotherapy in cancer, where many cancers that 5 years ago were largely untreatable, and if they were treatable with radiation and chemotherapy, are now treatable by just simply figuring out how in your own system you can maximize our ability to fight back. That's a healthcare NIH research kind of victory that we need to now continue to find out why it works on some cancers and why it doesn't work on others. This kind of research and commitment to NIH not only helps individuals and helps families, but frankly, at a time when healthcare is dramatically changing, has the ability to help our economy. The economy that figures out new ways to be in this healthcare fight is also going to be the economy that has the job opportunities and the transformational opportunities to be part of that. Not only are we looking at healthcare research, but also we're looking at research as it relates to the opioid epidemic. The opioid cost to the economy is now anticipated to be about $500 billion a year in lost work time, in other costs related to the opioid epidemic. This bill provides a significant targeted opioid funding. This is the 4th year in a row that we have increased our funding. And again, this is really only the 2nd time that we've had any more money to do it with. We've had to look at programs that weren't working and cut and reduce and combine those programs to really fight back on the opioid epidemic, which is now and for a couple of years has been the #1 cause of accidental death in the United States. #1 cause of accidental death in my state of Missouri. The 73,000 people that died last year with overdoses exceed the number of people that died in car accidents, which for decades had been the #1 cause of accidental death until opioids replaced it. We have $1.5 billion available for state opioid response grants, understanding that every state is different. Frankly, the more things that we try to do in different ways, the more likely we are to find the things that work. So we have that. There's more money for community health centers to expand behavioral health and substance abuse disorder services. There's an increase here in the ability to improve surveillance and prevention efforts in the illicit drug space or the drug abuse space. More money to research pain management. Part of the NIH money, $500 million, is designed to find more ways to research for better pain management and better ways to, if you have become addicted to drugs and opioids specifically, to end that addiction in an effective way. There's more money for the hardest hit rural communities, and some of our members have advocated strongly for a drug problem that is more of a rural drug problem on a per capita basis than it is an urban drug problem. More money for children and families who are put at risk by opioids. I saw a news report just this week of the number of kids, focusing on kids being raised by their grandparents because their parents wound up with an opioid addiction problem that drove their life in a way that their children were not only in danger and ignored, but had to go somewhere else. This bill prioritizes education programs through a student's life, focusing on programs that provide the most flexibility, again, for states and communities to meet the needs of families, children, their workforce in their state. There are increases for Head Start, increases for Title I support for low-income schools to help them meet academic challenges. More money to meet the goal that the federal government set decades ago, where individuals with disabilities are assisted within the school context as the federal government determined they had to be, but the federal government has been wanting and coming up with the money that was committed to do that decades ago. We continue to make steps in the right direction there, and I think in this bill some substantial steps. The flexible funding so that schools can look at more science and math and STEM education, more computer science education, more ability here for schools to take some of their funds and look at school safety. Nobody wants to see kids go to school in an environment that's not as safe as we could possibly make it. This allows more flexibility for local administrators and local school boards to decide how they're going to meet that school safety need. We look at impact aid and charter schools and programs that create both competition and fairness in a way that I think the people we work for will like. This bill maintains the significant investments that were made last year on college access. The best way to minimize college debt is to get done, is to finish. Year-round Pell, something we returned to after several years of having only the normal traditional school year of Pell. Year-round Pell is maintained in this as part of our federal commitment to have people going to school. And if you're an adult going back to school, if you're somebody who's a first-time college attender in your family, if for whatever reason you're paying for your own school, the most likely way to get done is don't interrupt a pattern that's working. This bill allows that to continue. We also do things that I think better prepare our workforce for the workplace. It's a bill that we look forward to working with members to see how it can be improved, just like the amendment that we'll be voting on here soon, that again, I'll repeat, deals with suicide prevention in ways that Senator Kennedy and Senator Reid have suggested and I support. With that, Mr. President, I would conclude my remarks